I'm Dr. Bircher.
I'm Dr. Bauer.
And I'm Dr. Sue, Dr. Sue Peck.
Tonight our talk is about introduction to brain-based therapy and functional nutrition for thyroid conditions. And as is obvious, the number of people who showed up, there's an interest in thyroid problems. It's a very common problem. And we'd like to start off with just what our training is and what we know about thyroids. Dr. Bauer and I are chiropractors. Dr. Peck is a nurse practitioner, and we've studied functional endocrinology. We're not traditional medical endocrinologists, but we've studied functional endocrinology with Dr. Datis Karazian, which is the textbook that we use and is available for sale if anybody's interested. We've also studied functional neurology, and Dr. Bauer and I are also both board-eligible chiropractic neurologists, and so the neurological part of thyroid problems we'll get into later.
Go ahead.
And some of my background is very similar with functional medicine training, although I came from the traditional medical model originally. That was my background in training, so I've got a foot kind of in both camps there, trying to blend the two.
Very good. And, just what we wanted to say is that, ultimately this is a talk that is meant to be educational, and we hope that you all learned something here this evening.
So the format is we're going to go for an hour for the class, and then we're going to take a short break, and then we'll open it up for about a half hour for questions. And I just wanted to start off with, again, the book, which I think is a basis of where we come from and is available. And also to say that one of the things that we offer is supportive care to medical care. We don't have any issues with standard medical care. We respect good medical care, and we refer to medical care when necessary. We have referred some thyroid people to endocrinologists if it's necessary. And what we do is we support thyroid function. That's why what we call what we do is functional endocrinology.
So, to begin with, I think it's important to discuss some different principles here. And those principles are what we really stand on here. And that is that all chronic health conditions, typically from a functional perspective, have some common threads, whether it be like the examples that we have on the slide, fibromyalgia, vertigo, or like what we're talking about here tonight, thyroid problems. They typically have these common threads. One of them is oxygen deficit. It may not be a situation where you are, your lips are turning blue, but, and that type of an oxygen deficit, but we're talking about metabolic issues that require more oxygen than what people can actually intake through normal breathing. In other words, the engine's running faster and consuming fuel faster than can be provided. Neurological misfiring. What we're talking about there is either the nervous system firing too quickly or the nervous system firing too slowly, and that input creating bad signaling through the nervous system. The next thing would be metabolic imbalances, and the common metabolic imbalances, these are what we call deal breakers, things that have to be addressed and things that must be dealt with, because if you don't deal with those things, you're going to end up running into trouble. And those would be the things like blood sugar problems, cortisol. When we're talking about cortisol, we're talking about adrenal function, okay? Hormone-related issues, anemia, and things like autoimmune problems, which we will also cover a little bit later. And we're talking about gut dysbiosis. Dysbiosis is basically just in simple terms, we've got good bugs and we've got bad bugs that live in the gut, and the good bugs should outnumber the bad bugs. If that shifts in the other direction where the bad bugs are more populous than the good bugs, that's a gut dysbiosis. And then brain imbalances. What we're talking about there is I always look at it as like the scales of justice. There should be balance on both sides. And if we have a situation where one side of the brain is firing more strongly than the other, that also is part of that neurological misfiring pattern.
So just get into a little physiology and where the thyroid is. I just had someone in the office today who was a teenage boy and had some cold hands and feet and some other issues, and Mom brought him in, and his thyroid was quite swollen. And she thought, well, you know, maybe I thought he had a sore throat for a while. So I had her feel the thyroid and feel where, you know, the lymph glands are. It's different. And she could feel the difference in consistency. The thyroid was swollen up. And it's something that's sometimes very visible. I can look out here and see a few that look like the thyroid's enlarged. So this just kind of shows a picture of where the thyroid is and about the size that it should be and the position of where it should be.
So getting a little bit into the thyroid function.
Speak up just a little. Some of the people in the back aren't able to hear.
Okay, we're sorry about that. I'll try, and I can speak more loudly if I need to, and I'll try and balance it out.
I'll tap him if he needs to speak louder.
But anyway, I mean, the reason we want to cover this aspect of things is because the thyroid is such an important organ, and that's some of the reason why we are discussing this evening, is simply because if you take a look at the list of things that the thyroid influences, it's pretty easy to see how important an organ it is. The thyroid is something that makes protein in our bodies. I tell people it's kind of like it's like a gas pedal. If the thyroid is working properly, then all of the other tissues in the body are functioning at their proper rate. If we have too much, then people tend to be a little bit hyperactive, hypermetabolic. People who are underactive tend to be hypometabolic. They tend to gain weight. They are sluggish. They're tired. People with hyperthyroidism tend to have a tendency to be more hyperactive and other symptoms that go along with that. But in this situation, we're talking about some other things that people don't think about, things like brain neurotransmitters. That's what people are being treated with things like depression and other things like that. The thyroid plays a role in the production of those things. How quickly your bone grows, growth hormone and tissue repair. If you'd go ahead and switch on to the next slide, and Sue, would you take this?
There's also some effects from prescription medications. Now, sometimes we need these medications for other things that are going on in our body, but at the same time, there might be an interaction with what's going on with the thyroid gland. These are probably some of the more commonly prescribed medications as well. And you can also see that levothyroxine and Synthroid, two different versions of the thyroid supplement, fall on this list. They suppress different things within the body with both the thyroid gland and up into the centers of the brain and the hypothalamus can be suppressed by these medications. So they're just some kinds of things to raise a question. How can we better support the body if we need to take that medication? Or are there circumstances where we might stop the medication because we know that the thyroid gland is being affected?
Yes, and another thing, I know not everybody maybe is taking notes. This will be available for people to be able to see, like online on our website. But another thing that isn't on there is female hormone replacement. Some women tend to be using female hormones as a replacement, either due to hysterectomies, things of that nature. And that is another thing that wasn't listed on that, and I thought it would be important to mention because it tends to interfere with the ability of the thyroid hormone to be available. The thyroid hormone gets bound up and can't be used by the cells. So, moving on.
So the nervous system we have in the beginning, because that's from our training in functional neurology, says that your nervous system is in control of all of your bodily functions, and it coordinates thyroid function also. There's a feedback system through your nervous system and also through the whole hormonal system. So we need to have a proper functioning and balanced nervous system, as he mentioned, for proper thyroid function. Those messages are carried by an electrical signal that becomes a chemical signal that gets to the organs. And so we want to make sure your nervous system is connected, functioning properly, has balance, and has a good fuel supply, which is primarily oxygen and glucose. And the neurotransmitter production, which he mentioned, is driven by thyroid hormone. So what we want to put out as a concept is that of all the thyroid issues, they're both neurologic and metabolic combination. I don't find them anyone who has just a metabolic problem or just a neurologic problem. It's both. And if you don't address both, you don't find a solution to the whole problem. This is just another list of what the thyroid supports, and we went through that already. But this slide gets up to the, talks about how the hormonal system feeds back to itself. The hypothalamus, the pituitary, and the adrenal glands are, the adrenal glands feed back to the brain, to the pituitary, and the pituitary sends a hormone down to the thyroid to tell the thyroid how much hormone to make. And the way I look at it is like a teeter-totter. If the thyroid's on one end, adrenal's on the other end. If you have a short, stressful situation that you need a burst of energy, your adrenal glands are supposed to pump some adrenaline, and when it does that, it suppresses your thyroid. And your adrenal glands drive your energy systems for a short time until that stressful situation is over. Then your adrenal glands turn it down and your thyroid turns back up and keeps your steady state energy going all the time. And the problem with modern life is that we have the way our system is designed is for short bursts of adrenal hormone, for short bursts of stressful situations. In the old days, it was running away from a saber-toothed tiger or fighting. So our adrenal glands aren't designed to be running all the time. When people are stressed all the time, their adrenal glands are up and they're suppressing the thyroid. Well, adrenal glands aren't designed to be running all the time, so they'll wear out. And when they wear out, the thyroid does come back online some, but then you don't have that reserve for those short bursts of energy anymore. So your energy systems get out of sync when your adrenal glands are either firing too fast all the time or get depleted and are exhausted. So this just gives an example of how they feed back to the brain then feeds down to the thyroid. It's all connected.
There's one other part that I'd like to just bring up about, if you want to flip back to it, and I'll point up here to the slide in just a second, but you'll notice that the red line also goes through this section of the body, right by the lower ribs, the upper stomach, and we talked about gut dysbiosis in that beginning list, because there's things with the liver and with the intestines that also come into play with converting one step to the next step to the next step in this whole feedback loop that goes on. So that's why sometimes it's really important to look at our gut function, what we're eating, how we're digesting it, in order to really have the whole picture work together. It's all connected.
Mm-hmm.
So right in here.
So,
Right in here. That's where the liver and the stomach would be. It's not shown on the slide, but those two organs also need to be included.
very good. This is just a little bit of a basics on how the thyroid actually works, and it'll do some things to kind of qualify some of the reason we do the testing in our office from a blood testing standpoint a little bit differently than what is standard medical testing. You know, ultimately we have a part of our brain called the hypothalamus, and that hypothalamus sends a releasing hormone down to what's called the pituitary gland. Okay, sorry, louder. Sends that down to the pituitary gland. The pituitary gland is actually something that takes feedback from all of the organs, you know, all of the hormone or the endocrine organs in our bodies. We're talking about not only the thyroid, but also the male and female reproductive systems, the pancreas, the adrenal glands, okay? So that takes in that information. But ultimately, via a hormone called TSH, for those of you who have been thyroid patients and have gone over your test results, this is a common thing that your medical practitioner will test, is your TSH level. It just basically is telling us how strongly is the pituitary sending its signal to the thyroid gland to say, hey, we need some more thyroid hormone, okay? Next, what we see is that TSH causes an enzyme TPO, okay? That's short for thyroid peroxidase, and that stimulates the release of T4. Now, it gives you some ideas that we have both T4 and T3 hormone. The T4 is, I kind of give people an idea that T4 is really not used in the body. It's not a usable form. It's kind of like a candy bar in a wrapper. you know, you don't eat the wrapper along with the candy bar, okay? But the T3 is something that your body actually uses. Now, a lot of that T4 actually gets sent down to the liver, and then the liver takes the wrapper off the candy bar so that the cells can actually use it at that time, okay? So that's the usable form of thyroid hormone. Will you go to the next slide? Then basically the liver takes that T4 and converts that over to the T3 and the usable form. Now, poor liver function, and what Dr. Sue was kind of talking about here previously as far as the liver being involved, is the reason that a sick liver can play a role in thyroid issues is because if we don't have a good liver, then what ends up happening is we can't have that T4 to T3 conversion taking place. So we've got a whole lot of candy bars and wrappers, but none of the cells can eat it because the wrapper's still on, okay? And then 20% of that T4 is sent down to the gut, and most people have heard of the term probiotics or maybe acidophilus, those types of things. Those healthy or good bugs actually also perform a role of converting some of that inactive T4 into the active form of T3 that the cells can use. And then the percentage of T4 sent, there's also a small percentage of that T4 that is sent over to the peripheral cells, and that's getting into, I think, a little bit more complicated stuff that people don't need to get into. And then finally, a percentage of that of the T4 goes into a form called reverse T3, which is something that is also tested. So moving on.
So just a quick thought on why T4 and T3, and the way it was explained to me was that your thyroid produces T4, which is unusable because that way it can send T4 all the way down to your little toe, and it doesn't get used up until the little toe needs it. Then the little toe can convert it into T3 and have active metabolism. So that's the reason why there's T4 and T3, so that the thyroid can send hormones all over, and it can be used as the body needs it, rather than if it all came out as T3, it all get used up right here. So there's 6 major patterns that we see, and what we mean by patterns is what's going wrong with the thyroid. And what we mean by primary hypothyroidism is that means that the thyroid gland itself is just low functioning. And the next one we see is hypothyroidism secondary to hypopituitary, and that means that, as Dr. Bauer was saying, the message from the pituitary gland by TSH tells the thyroid, make more thyroid hormone. If your pituitary isn't doing its job, then the thyroid won't either. So that's secondary hypothyroidism. And the next one is thyroid hormone underconversion. And we just talked about T4 conversion to T3, which is active hormone. If the liver, the gut, or the peripheral tissues don't convert the T4 to T3, you can have normal TSH, you can have normal T4 and sluggish metabolism because the conversion isn't happening into the form of T3. We also have overconversion, so that the body gets confused from the T4 T3 balance gets out of balance. And there's also thyroid binding globulin, that's what carries it around, can get interfered with contraceptive hormones, as he was mentioning earlier. And then the last one is something called thyroid resistance. And what the example of that is your cells, every cell in your body has a thyroid receptor. And so the cell wall has a receptor, and the thyroid hormone comes to the cell, and when the cell needs more energy, the thyroid hormone gets inside the cell and drives the inner machinery of the cell to produce more energy, take more oxygen, more fuel, burn it, create heat and energy. So what happens if the thyroid gland produces too much thyroid for a while, the cell will pull in its thyroid receptors. So the thyroid hormone can be there, but the cell isn't taking it in. It's resistant to the thyroid hormone. Right. And then you will also have all the symptoms of thyroid problems. And that's why the name of the book, Why Do I Still Have Thyroid Symptoms When All My Tests Are Normal? The reason he talks about that in the title is because it's a very common thing. You can say, well, I went and had my thyroid tested, and they were normal, but I have all the thyroid symptoms. And here's some reasons why that would be.
Right. And the thyroid resistance, I mean, most people have, diabetes is a very common condition, and many people have heard of the term insulin resistance, or, insulin resistance is very similar. The process is very similar. There's so much insulin in the body that the cells draw back those receptors, and the cell's no longer responsive to insulin, and that leads to that type 2 diabetes. Anyway, just going on to what our approach is and how do we take on people who have issues with thyroid problems. Obviously, the foundation of any good doctor-patient relationship is we have to take a good history and we have to take a good examination. It's important that we hear people's stories, the things that they've tried, the things that have worked, the things that haven't worked. Based upon what we see, then typically we are going to be looking at doing some type of testing, typically a more expansive thyroid testing, depending upon your symptoms, possibly gut function testing, adrenal testing, hormone testing, things of that nature. Then we would go through, and based upon what we see there, we would go through a standard report of findings. We would sit down, discuss what the options are and really what the problem is, and then basically figure out what we are going to do about it. Ultimately, we tell people it's ultimately your body, your health, your choice. We are not strong-arm people around here. What we feel like our job is to do is to be able to educate people, let them know what their problems are, and then let them decide what level of care that they want to participate in.
So here's some examples of things that we do. We do, again, as I stated earlier, all thyroid problems in our experience are neurologic and metabolic. And so we do some neurologic tests and metabolic tests, and just here's some examples. We do things like blood pressure on both sides, tissue oxygen saturation. We have a meter that if you go commonly in health hospitals and emergency rooms, they put a sensor on the end of your finger that reads the amount of oxygen saturation in your red blood cells. We do that also, but we add one more level to that. We have a higher functioning unit that measures something called perfusion index, or how much of that oxygen is leaving the red blood cell and getting into your tissues. Because your cells have to have oxygen and glucose and the thyroid hormone to drive that metabolism to make energy. And the most common reason that people show up with thyroid problems is energy issues, or weight is another one. So heart rate and rhythm, there's just some examples of some of the tests that we do. They're not eye tests, cranial nerve tests, cerebellum tests. We'll get into that in just a minute. And then he mentioned some of the metabolic tests. A deal breaker, and one of the things we learned from Dr. Karazian is if somebody has blood sugar problems, which are very common, and you try to deal with their thyroid problems and you don't fix the blood sugar problems, you won't fix the thyroid problem. It's literally impossible to fix a thyroid problem if you have a blood sugar control problem. So that's why that's at the top of the list. Adrenal function. I talked about the teeter-totter. If the adrenals aren't working properly and you try to fix the thyroid, you won't get the job done. And cortisol comes from your adrenal glands. And again, we'll test thyroid hormones and some antibodies if we think there's autoimmune issues, if there's other hormone, female hormone or male hormone issues, gut and immune panels if we think that's necessary. So we do a little bit more comprehensive panel than is commonly done. I see them virtually every day, and we get them from other places, and so I see what's done. And we do a standard panel that has 45 different tests, and then we add to that the full thyroid function panel.
Right, and this is a little bit of what we were talking about. In this situation, most of the thyroid tests that we see come in are either just simply a TSH, or in some cases, if they're getting really creative, they're going to do something along the lines of maybe a TSH and a T4. Those are the main things that we see. And I just explained that, the standard in medicine at this point is really using the TSH as an indicator to determine whether or not, if we have a high TSH, then typically the thyroid hormone is low, and we give levothyroxine or Synthroid, something of that nature, and that's the end of the situation. It doesn't really tell us about the function of the thyroid hormone or the thyroid as a whole. So the T4 total is important, but free thyroxine index and free thyroxine are also important. What I explain is there are different forms of thyroid hormone. You have a protein-bound form, which is also relatively unusable, and you have the free form, the form that is more usable, okay? And then finally, the T3 uptake. This is something that's determining whether or not your cells themselves are actually taking in the T3 into the cell itself, okay? Free T3, why do we do that? Again, we want to make sure that we're having proper conversion taking place, that we don't have any signs that would indicate that we're maybe having some liver issues or some gut issues, and that would point us in that direction. Reverse T3, sometimes we can have a situation where T3 is being over-converted to reverse T3, which indicates some different type of problems. And then finally, what's called TPO and TBG antibodies. This is to determine whether or not we have some type of autoimmunity coming on. Autoimmunity is just simply where your own immune system is actually attacking the thyroid gland and interfering with its function. Okay? I don't know what you would say as far as a percentage, Dr. Bircher, but I mean, a large majority of the people that we do testing on who have thyroid issues do indeed have the Hashimoto's problem, and they were never tested for it, and we're the first people who actually identify the problem. And the thing that's important to understand in that situation is those people functionally have a thyroid problem, but in reality, from a treatment standpoint, what they have is they have an immune system problem. Okay? They really don't have a thyroid problem. It is an immune system that is tripping up the thyroid and not allowing it to function as well as it should. It would be similar to taking a fast runner and making him wear lead-weighted shoes. You know, he doesn't really show his full potential there because there's something impeding his full performance.
And we talked about already that common, and I've been doing this for 33 years, and I've looked at lots of lab tests, and 90% of the ones that I see come from other places, they do just a TSH or a TSH and a T4. And seriously, how can you manage that whole picture that we just talked about, those 6 basic patterns, if you don't have enough information? So that's what we do, is we do enough to get the information that we need. And again, these are some of the other tests that we do. We test for gluten sensitivity in some people, organic acids, stool test, adrenal stress index, which we'll get to in just a minute. Food sensitivities is something that we test for commonly because that's some of the reason why he just mentioned that we see a lot of people with thyroid problems who have autoimmune thyroid. Where does that come from? And sometimes it starts with food sensitivities, which drives the immune system to overreact, and it can start attacking other tissues. Infections can do that also.
Right, and it's important because, you know, we talked about gluten sensitivity, very common thing in people who have thyroid problems, but the reality is there can sometimes be, I'm sorry, I'm not talking loud enough, there can sometimes be situations where gluten is not the only sensitivity. And what I explain is that if the thyroid is attacking, or the thyroid is being attacked by the immune system, anything that stirs up the immune system, meaning an allergy or an infection, that can also increase the attack on the thyroid. So it's important to have those food allergies or food sensitivities identified so that there are things that are within your control as the patient to be able to avoid. And that's really what it comes down to, folks. It isn't necessarily putting the power into our hands, but putting some power into the patient's hands and being able to have them have some things they can do for themselves as well as what we can do for them, because it is a team approach.
The adrenal stress index we mentioned is a common problem along with thyroid because they work together as I described. And this is just an example of the report that we get from the adrenal stress index that we use, which is a saliva test, a very accurate way to test adrenal gland function. And stool tests, we find a lot of people, again, part of the conversion happens in the gut, so if there's a problem in the gut, there's a way to test that. And based on those findings, we can prioritize where is the problem. When we have the history and we have the test, we can say, okay, the primary problem is in your gut, or it could be a food sensitivity, or so that's the place to start on that list of getting your body to work better, prioritizing what needs to be done first, because sometimes when you've already tried 20 different things, it gets old and it gets frustrating and it's easy to give up. So it's important to try to prioritize your efforts so you get the best result out of the work that you do. So these again are just the areas that we treat. We're going to move through the slides a little faster because we're a little bit behind on time. So common question, how did this happen? Why is it so common? And some people say 30% of the population has thyroid problems, so it's a big problem. And there can be chemical insults from toxicity in our diet, in our digestive issues, physical trauma where we get injured and throws off our nervous system, and emotional trauma and stress, which causes the brain to decrease its frequency of firing and causes that imbalance on the right and left side of the brain, as Dr. Bauer was talking about earlier. And so here's just some examples of how the brain interacts.
Exactly. And so ultimately, what a lot of people understand that the right side of the brain is something that controls the left side of the body, and the left side of the brain controls the right side of the body. Now, what we see here in the examples here is we have a cerebellum that is on the back part of our head here, the back part of our brain, and that sends information from, in this case, the right side of the body to feed the left brain. Okay? Then we also have a situation where the left cerebellum feeds into the right side of the brain. We see this big arrow here that comes all the way around. That fires into our lower brainstem. And what a lot of people don't understand about the brain is kind of a braking system. Okay? It puts the brakes on a lot of different things. It makes sure that our heart rates don't go crazy or run too fast. Make sure we don't oversweat. It's the sympathetic or that fight or flight part of our nervous system. And when the brain is firing properly, what it does is it goes down and fires to the lower brainstem and then into the midbrain, which is part of the upper part of the brainstem, and that keeps that whole process kind of under control. I always say it's kind of like the parents have to keep control of the kids, because otherwise they're going to tear everything apart. Okay? So this is kind of an example of what happens in this situation. We're seeing a right cerebellum that is under firing to that left brain. Okay? So we don't get the left brain actually sending its signal to shut off function in that lower part of the brainstem. However, the right brain, because the left brain is under functioning, actually overfires, and we get an overstimulation. Now, in this model, what that ends up doing, we get kind of an oversuppression, and then everything kind of has a tendency to slow down slower than what it should.
And that can cause some of the symptoms of thyroid. People say, well, I'm tired. Your brain can be tired, and your thyroid can be okay. So that's why we say there's always a neurological component to this.
So, the symptoms that people experience that are associated with the imbalances that take place between the left side of the brain and the right side of the brain. And in this case, we're talking about an overactive midbrain. This results in chronic fatigue. It results in a lot of the fibromyalgia cases that we end up seeing. And as Dr. Bircher was talking about, ends up resulting in energy issues, either due to the fact that we are being too suppressed or we're having overfiring that's consuming more energy. It would be kind of like saying, you're getting fewer miles per gallon. You've got the same amount of fuel coming in, but your body's burning things up faster than what you can put in there. Okay? Increased sweating, blurred vision, heart palpitations, all of these things are contributors or are contributed to, I should say, by brain imbalances. Continue on. Symptoms resulting from disruption in the brain's electrical activities. remember we talked about neurotransmitters, episodes of depression, anxiety, difficulty in some of the cognitive functions, things that are things such as adding and subtracting, being able to remember things or being forgetful. These are all things that are indications of imbalances in the nervous system that ultimately are going to be things that will contribute to poor neurologic firing that also involves regulation of your endocrine organs.
These are just some pictorial examples of when the midbrain overfires. Those are just some examples of some of the symptoms that you see. At the top of the list on the previous page was depression, which is there's a lot of people being treated for depression with medications that don't really treat the cause. Sometimes the cause is low brain energy. The brain energy is literally depressed. It's not that they're missing neurotransmitters, that the brain energy is depressed. And so you need to get the energy up and the brain work better. The person has more energy. They don't need antidepressants most of the time in my experience. Some people need them. Most don't in my experience. Again, just some examples of when your brain overfires, you get sensitive to light because your pupils stay wider open and they don't shut like they're supposed to be. You don't fall asleep as easy. It leads to circulation issues because it overfires the control of the veins and arteries to your brain, which leads to migraines. Again, just a few examples, which I saw one today that's coming up here. If your midbrain is overfiring, then it doesn't allow the intestines to do their normal peristalsis to allow food to move through, so they get constipated. Also, it doesn't allow the bladder to empty properly, so there's urine staying in the bladder, leads to urinary tract infections. So the overfiring brain is connected to a lot of different problems. And again, difficulty falling asleep. And this is a good slide because when you have overfiring brain, I hear people say, well, for some reason, I just wake up at 3 a.m. in the morning, and it seems like I'm wide awake, and for no reason. It's because your brain's overfiring, and that's a time of the night when it is at its peak. And then the converse will happen, as it says on there. The lowest firing time is 3 in the afternoon, and the same people who have that waking up at 3 a.m., what happens in the middle of the afternoon? I think I need my cup of coffee to keep this thing going. So the brain energy has a lot to do with a lot of those symptoms also. And I'll just try to speed this up so we can get to some questions. So fibro fog, just this foggy-headed feeling where I can't think clearly, I can't answer questions, it's hard to remember as well. Neuroplasticity is a word you see in the press.
Yes, and I think it's important to discuss neuroplasticity because ultimately what we're dealing with here and the concept and the basis of what we're doing here when we are treating people neurologically is there has to be this concept of neuroplasticity. In the old days, what it was believed is that the nervous system was kind of something that was an inner sanctum. It's something that could not be changed, okay? What is being found is that no matter how old you are, that people can actually see changes in the health of the cells in the nervous system, that the firing patterns within the brain can change. And the term neuroplasticity is something that just simply refers to the fact that, plastic, which is moldable, shapeable, you can make it into just about anything you want to. It's using that term to refer to the plasticity of the brain, that the fact that you can actually change your brain. You can change how your brain functions and how it fires.
You can change the connections in the brain. Mm-hmm. The actual brain cells and the nerve fibers don't change a lot, but the interconnections between them can definitely change at any age with the proper nutrition, with the proper stimulation and fuel to the brain. So we just talked about the basics of what it is that we do in functional neurology. The brain needs fuel, and the main fuel that the brain needs is oxygen and glucose, and your brain needs activation. And that activation, we need activation in a balanced way, and I use the example of, for a healthy brain function, we need to have activation, and we need something new on a regular basis, and we also need something that's the same. If we have too many new things, it creates chaos. If we have everything the same, we get bored. So we need some new things. We need some new thoughts. We need some new experiences on a regular basis to keep our brain growing and keep our brain energy up. And we do things in the office. Here's some examples of some of the tools we use. We use vibration, adjusting on certain parts of the body to stimulate the brain and nervous system to wake it up. We do things to create stimulation and add fuel to the brain, like upper body ergometers, where it's like a hand bike breathing oxygen from pure oxygen from a concentrator to provide fuel for the brain. And this is just a list of some of the other things that we use: home exercises, posture exercises, balance, eye exercises that we recommend to help balance the brain. And we'll just try to move through these so we can get to a review of what we talked about. And this is just a kind of example of the neuro part and the metabolic part. There's confusion. Those parts are not connected properly. And what our jobs are is to take a history, exam, do some tests, put this together and find out which parts are out of place and try to make some sense out of that and come up with a plan to start putting those in some better order. When your body is in better order, it functions better. And then as we correct the brain misfiring and get the metabolic functions increased and more balanced, we start to tighten that up a little bit. And ideally, when your body's on the right track, they're all working together in a balanced way so that your body has reserve energy. The adrenal glands can, if something stressful happens, which these days it's going to happen sometime soon, it seems like there's stress going on all the time, that we need to be able to handle those things or we get worn out. So to have a whole person, we want all those things working together and have some reserve fuel that we can handle whatever comes up.
So really, in order to determine whether or not you would be a good candidate for doing the type of work that we do here, what we offer you is 2 visits. The first is an extensive metabolic and neurologic review. What we tell people is that if it's a situation where you have some previous testing, things that you have had done in the past with your medical physician or possibly with another health practitioner, we ask you to bring that along with you. We also would need to be taking a look at doing some of the neurologic testing during the course of that time to be able to see where, if anything, any neurological imbalances would lie and what we would need to do to treat that. In other words, it helps us to be able to qualify you as to whether or not you even have the problem, and also to quantify so that we can determine what we'd actually need to do in order to be able to make a difference. And then at the second office visit, it is just a report of findings. Ultimately, we take the information, we put it all together, and then be able to come up with a treatment plan that is something that will work for you.
And what we're looking for is, it's frustrating for you and for us to do things that don't work. And so what we're really looking for is we're committed to doing the best that we can and looking for someone who's committed to doing the best they can, work together and get the job done. So that's why we put on there a scale of commitment. You know, we're committed to getting all that information, putting it together. Are you committed to doing that and then following through? And if you are, great. It could be a good match. Medicare and some insurance pays for some of it, some don't. And we just had people talk to our insurance department. And sometimes, like, Medicare pays for some of the testing if you see Dr. Sue, but not for us. This is the way Medicare works. And so we also have payment plans available if that's necessary. And so what we're offering tonight, if you're interested, is we have a deal which is $89 for those 2 visits that we talked about. Normally that would be $300. It'd be about $400. So it's a savings of $300. And in order to get that, we just need you to sign up tonight if you're interested. And also, we always recommend bringing someone along because our experience is it works a lot better if you do. Because when you go home and say, well, I found out all this information, and this is what I have to do, and your spouse goes, what? And it's going to take 6 months and it's going to cost that much? What? It's important. And then I just had someone yesterday who, when I was doing the exam, and I was doing part of the exam, and her husband was sitting there, and this lady didn't get what I was doing when I was doing a neurological exam, and he's sitting there going, wow, she can't do that? That's important. We need to get that fixed. And so it really helps to have someone at that home that you can have as a support system. So that's what we need: information and outside lab tests we mentioned in there if you have it. And then we present a plan, and then you decide. As Dr. Bauer said, it's your health and your choice. We don't beat anybody up. We offer the best that we can do and try to follow through with that and ask that you do the same. And thanks for coming, and we're going to take a short break, and then we'll open it up to some questions. And during the break, what I just wanted to explain is that if you want to do that, just talk to Vonnie or Peggy up front, and they'll take some information. You can take care of that, or and now we can just open it up to some questions. Anybody? Or did we do such a great job that we answered all your questions? No, there's one. There usually is. Go ahead.
What did you mean by numbers in the paper there? It said, what were your numbers? My doctors never said, should your thyroid exam have a certain number?
Your TSH is commonly, yes, all your thyroid numbers have a certain number.
Yeah, there's a range that they should fall into. And essentially, most lab tests have a range. Your body is always fluctuating and changing, but as long as it stays within a certain range or a certain boundary, then it's considered to be, a normal test. And if you're below, then that's a problem. If you're above.
So here's an example. The range for TSH, which is the most common test done for the thyroid, for most labs it's 0.5 to 4.5. It varies a little bit depending on the lab. That's quite a wide range. The American Endocrine Council, which is the experts in endocrinology, say that TSH should be 2.5. Exactly. And some people could be 0.6, and they're told, well, you're in the range, so you're normal. 0.6 is a long way from 2.5, and I'm telling you that your thyroid is not working right if it's at 0.6. It's not functioning properly, but it's in that range, so people are told it's normal. It's not normal.
Okay, if one is taking the levothyroxine,
Levothyroxine, I believe, is what you're talking about.
What is the other medication besides that you can take as a supplement?
Synthroid
Synthroid.
is a common one.
What's the two?
They're basically the same thing as far as I know. There's a thyroid expert.
They're just two manufacturers, two different names. Levothyroxine is considered what they call a generic name, and then that was the original drug made, and then when the patent thing or whatever reached its date, then any company that wanted to could pick it up and make their own version. That's where Synthroid was made. It's just a version of that levothyroxine.
Right.
Is it true that if you have a thyroid problem, that it'll never go back to normal?
No.
That's been told to me by
That's
you.
not true. I mean, what I tell people is there are some conditions, primary hypothyroidism, that's the only of those. Remember, we discussed those 6 patterns. Primary hypothyroidism is generally recognized as the one type of thyroid problem that is going to need to have some type of medication support. The other 5 that are present there are typically very treatable, or I should say very manageable through doing natural means. You just have to find out where the fault is in the mechanism of the thyroid. Is it in the liver? Is it in the gut? Is it in the pituitary? Where is the problem? And if we address that problem, as well as address the neurological issues that are creating that problem in the first place, you can see some resolution.
Does the probiotic, like yogurt or probiotic milk and some of these products, do they actually help the antibodies or the stomach?
Sure. I mean, I guess the best I can say to people is that yes, those things do help, and it really comes down to that there are smaller amounts of those bacteria in the food products, and then for people who have a more severe problem, usually we direct them to use like a tablet form that has a larger concentration of the probiotics in a tablet or a supplement form that they can take. You know, there can be a number of issues. You know, the best I can say is, you know, some of the more common things I run into is somebody who would like to get their probiotics through, say, eating more yogurt, but they're allergic to dairy. So they have to take...
Or if you're choosing
you
a
know.
brand with a whole lot of sugar.
Right, right.
Does stress have anything real, I mean, heavy stress, have anything to do with the thyroid?
Absolutely, yes.
I wanted
yes,
to qualify my answer. You answered about the thyroid medication, and I said no, people don't need to take it the rest of their life. There are a few people that do.
Right.
It's a small percentage of people that have a thyroid that's damaged, it's not coming back, nutrition isn't going to fix it, they need to take levothyroxine the rest of their lives. So I wanted to qualify my no, is that there are some people that do need to take it the rest of their lives.
We have a question
Right
from this
here,
lady
this
right
one
here.
first, and then the next one is back there.
Okay, thank you.
I was just, I'm not sure if I remember, there were 2 visits. Does that include all the tests that were listed? I'm a little bit confused.
No,
with
no,
that
ma'am,
part of it.
no. It's essentially with the test or the visits themselves are essentially to diagnose what the neurological issues are, and if you do have some worthwhile testing, that's something that can be used. But ultimately, if you don't have the testing or your history suggests we need to do something more expansive, then that's something that would be discussed at a report of findings. Does that make sense?
Well, it does, except for the way I understood it is that you had to have some of these tests done before you could determine any issues.
I understand, and obviously if we don't have enough information, that's something we would probably discuss with you at the first visit so we could have something to discuss at the second. Does that make sense? Okay.
I was diagnosed with that Graves' disease, so they gave me the radioactive pill.
Yes.
Twice.
Yeah.
So, can you help me, being I don't have a thyroid?
Mm-hmm.
I'm kind of a mess with the medicine, and I actually take the armor
Yes, that's good. That's good.
and fight for it, but,
Yeah.
so you can still straighten me out even though they tell me. And then the
Well-
test, I tell my doctor, you take the test, you're looking at what's happened in the last 2 months. If I change my eating and eat something that, I don't know if it affects my liver, I can tell within 5 days I can't keep my eyes open.
Right.
So
Right.
is there a test that you can tell from the last week if I got enough medicine or, yes? Is it a blood
I'm just
test?
pointing to her back
Oh.
there, sorry.
You know what I mean?
Yes, all the other tests that we talked about, liver function tests, adrenal tests, gut function tests, if we put those together, we can put together.
As far as the thyroid medicine, can you tell?
I guess here's the bottom line. I mean, I understand what your question is, but I've worked with people who are like yourself with Graves, and what I explain to people is that ultimately it's usually deficiencies or some problems in those other areas that lead to the seesawing activity that goes on with, oh my goodness, my TSH is sky high, oh my goodness, now it's too low, and all this medication adjusting. It's the other factors that we're talking about, the adrenal dysregulation, the gut issues, the liver issues, sugar regulation problems, those factors, because they connect to how your thyroid is operating. The way I've put it to people is that the hormone system in the body is kind of like an orchestra. You know, you can have everybody playing in tune, but that one person playing out of tune kind of ruins the whole song, okay? And so you have to have that information in order to be able to determine, are those other parts playing in harmony? And if not, then you can't expect the medication and consistent medication taking to have a regulation of how your TSH is going to behave. Does that answer your question? Because all I can say is there a test, like you're saying, that can say how it is last week or this week? You can take a TSH test every week. But
I remember there was of course it was on the internet, and I don't know if they did a tissue test and they could tell how much thyroid hormone was in the tissue.
Okay. If it is, it's something I'm unfamiliar
I'm not
with.
familiar with that either.
There's a
The
question
next
in
one
the
is
back.
back there, and then here in the purple, and then here up front.
Okay.
So I recently had thyroid cancer,
Okay.
and so they just took it out. But I was wondering, could everything still be functioning properly, even though the thyroid itself had cancer in it? Or how defective is the thyroid? There was 4 spots of cancer, 2 on the right, 2 on the left.
Mm-hmm.
So how defective was? They said it was a slow-moving cancer, so I'm assuming it had been there for quite a while.
Mm-hmm.
So how defective then was the thyroid? Or could everything still be working as normal? Do you understand what I'm saying here?
I do understand what you're saying, and I guess the fact that what I would say is the deeper issue is that you had cancer. I mean, so there's something bigger, obviously, going on than what than the thyroid itself. And is it possible that your thyroid could return to normal? Certainly so. Yeah, I mean that can return to normal. The thing I tend to think about with people who have developed thyroid cancers is I think about things like heavy metal toxicity and things of that nature.
Sugar in your diet.
Yeah, those types of factors. I mean, it's just a matter of certainly you'd want to address the thyroid, but you'd also want to. There are certain other areas that we would want to look at in order to deal with some of that other underlying issue, something that could have contributed to that coming on in the first place. Do you understand what I'm saying? So.
They said it was a cyst that had ruptured. Does that make sense? Like, how do cysts like get created on your thyroid? There was multiple cysts on there.
Mm-hmm.
And what happened is I got hit in the neck by something, and the cyst had ruptured. So I was going in for quite a while getting it drained, and then just over a period of time, cancer had formed in where the cyst had ruptured.
Okay.
I don't know. Maybe it's too much into detail.
Well, no, I mean, that's fine. I appreciate your bravery in sharing your history and that sort of thing in a large group of people.
But it can still function normally with those systems.
Yeah, and I think it was for quite a while.
Yep.
Yeah.
And I had to go for the biopsy, and that's when I came back
Right,
like that, so.
right.
Right here in the purple.
I went to see Karen Hurd also, and I was going to Dr. Berger too. And she suggests, I've been on this thing, because I was 18 years old, and they told me to go on thyroid medicine, and I've been in California and other places, and they told me I could never get off of it. And when I went to see Karen Hurd, her idea was to take beans at every meal and to forget the sugar, and I guess basically, is that possible? Is that a way to go, just maybe cleaning out your body with just the food for going off of your thyroid medicine?
Well,
Or she said maybe you
I
could try going cold turkey and see how it goes. And
I agree with her philosophy with the fact that eating baked beans, because they're so high in fiber, can bind toxins in your body and then you them out. Okay? I agree with that part of it. And if indeed it's a toxin that's in our system that's leading to something going wrong in our gut or something going wrong in our liver or somewhere else, if it's helping to get rid of that toxin, that's a good thing. Would that be enough? In some people, yeah. In other people, they may need other things, and that's where some of these other tests would come into play, with taking a look at where's the problem to begin with.
Right.
Up here, and then we'll go back there.
My question is with goiters. And is your, are they treatable, or is it, we've been advised for surgery? Is there, we're looking for another option as far as, a way to treat.
If you don't mind me asking, is this a situation where they're talking about like an iodine deficiency goiter?
It's been suggested. I don't think it's been pinpointed to that, but there are a few and increasing in size over time. Still normal thyroid function though.
Okay.
Is
Based upon a TSH. Okay, so I I don't know, you know, I guess the reality of the situation is, you know, when you're talking about goiters, you know, 9 times out of 10, you're talking about a situation where there's some problems either with, you know, iodine in the diet, or there's, or it's a situation where you're having trouble with uptake of iodine into the system.
And that is something that can be pinpointed through.
That's something that's hard to test because there are things like fluoride that can interfere with iodine uptake with the thyroid. Heavy metals, lead and mercury, and fluoride is another one. That's something that interfere with the uptake, and then it causes the thyroid to enlarge. So there's, without more information, we couldn't say.
Right.
You have to do some tests to figure it out.
Would the sessions that you're offering, would that give us some more insight on that? Or would we need to go further?
Well, the testing would drive what test would be done to confirm that, yes.
Right. I mean, what tests you had, and also the results of your history and exam. Again, you know, it's, I guess the best I can say is we aren't a canned practice, meaning we don't give the same thing to every person. That's why we do our exam and our history, so that we can decide based upon what you're telling us, what should we do. So the answer to that question is, could we discover some things? Certainly that's very possible, but likely you would need to do some further testing.
Okay.
Does that answer your question? Okay.
Back over here in the center.
I'm just curious if a person or an individual is diagnosed with either hyper or hypothyroidism, why does the medical community place that individual on medication for life? Why do they state that you need to be on it forever? Is it that the thyroid medication changes what the function of the thyroid does, maintaining a requirement for that medication?
Right. I mean, there tends to be a feedback system. Yes. I mean, if you put the
go off of it, say you, for example, had, you know, hypothyroidism, which a lot of folks have, and the medical community will only treat that when it gets to a certain point.
right.
Is that medication required forever?
My early answer was no, with the qualification that there are some people, but what happens is that once you start taking a hormone from the outside, then you interfere with that feedback loop that we described in the one picture, where the tissues send a message to the brain that says, I need more energy, so the brain says to the thyroid, make more thyroid hormone through the pituitary gland, and if you're just throwing thyroid hormone in there, the body thinks it has enough, so you interfere with that feedback loop. And once you interfere with that and it becomes a habit, you take it away, people feel bad. So, and it would take a lot to get that back online. So they say, well, rather than try to figure all that out, just take it forever and it'll be at this rate. The other part of taking the thyroid out or taking thyroid hormone at a certain rate is that that feedback loop should be able to adapt to your environment. If it gets cold outside, you need to generate more heat. If it gets hot, you need to generate less heat. If you need more energy to go play a game or rest, your adrenal glands and your thyroid should be able to speed up and slow down to your required situation. When you take thyroid hormone at 100 milligrams or micrograms, whatever it is, per day, your thyroid kind of settles into that and stays at that rate all the time. You lose your adaptability. Your feedback loops don't work the same anymore. And then, again, if you take it away, then you don't function right. So, well, just keep taking it to keep you somewhat stable. That's why it's common to say, well, you just got to take it the rest of your life, because they haven't figured out what all those other systems are doing. And if you don't fix those other systems, then you can't fix the thyroid.
Right. If you get a diagnosis of either one of those two things, and you decide to stay medically relating versus chiropractically or holistically relating, do you feel that an individual should have a discussion with their physician to say, well, what's causing the hypothyroidism or the hyperthyroidism?
I think you would be a fantastic teacher in helping spread holistic medicine.
Yeah, yeah.
Is the holistic practice the only place where further in-depth evaluation can happen? The medical community is not typically a place where you can get that?
No. Well, in general,
In
I mean,
There might be a provider in a private clinic somewhere who does more of it, but typically in some of the larger systems, it's done this way.
There's protocols. If
Yeah.
you have these symptoms and this test, you take this. And the protocols are driven by what insurance pays for. That's the way it works.
Yeah. The other thing I wanted to just point out too, just in regards to what Dr. Bircher was saying, you know, talking about losing these feedback loops. I mean, this is something that's why the neurologic aspect is something that's important, because that's something that helps to restore some of that brain information to be able to return people's bodies back to more of a state of adaptability.
And that's why on that graph, one of the previous slides I went through quickly, it had a pie graph and it said neurologic was 60% of the problem, metabolic was 40%. Because the nervous system is the best feedback system. It's feeding back system information all the time,
Right.
very quickly, instantaneously.
Right.
Okay, in the back there, and then this lady here.
I wanted to ask, from the medical point of view, my understanding, I want to know if I'm correct. If you take Thyroid or levothyroxine, I was under the impression that because your thyroid doesn't need to make anything anymore, it'll atrophy. And that's one reason you have to keep taking it forever. Whereas if you have it supported by natural supplements, eventually the thyroid, actually the lab value will actually be normal, in the normal range. Not low and not high, but kind of in that middle where it's supposed to be exact. Is that correct, that the thyroid won't function anymore because it doesn't need to? Or am I-
Again, I think it depends on the individual. If it's been shut down significantly for that person for a long enough period of time, it may not kick back in. But when we're looking at doing some of these other therapies that help stimulate the nervous system function, it's possible you could turn the loop back on. So we
Right.
can't give you a definite answer, but it's possible.
Right.
Well, I've had a personal experience, which it's with my, a pet who had very low thyroid, and they wanted to put my pet on levothyroxine, and I've used natural products, and it took about a year, but the thyroid level is nothing.
Hallelujah.
Yeah. You know, and so I thought I'd go to Thyroid if I had to for my pet, because I love my pet and I treat all living the same as me. I don't want to do something that I wouldn't do, but so that's why I did that, because I was under the impression that my pet's thyroid wouldn't work anymore ever again if I didn't try to support it first. Okay.
One more question, and we've gone over our time, so I'm just trying to be aware of people's schedules.
You said you can see visually if somebody has a thyroid issue, what would you be looking for, and what do you know about thyroid nodules?
Well, you can see someone with a large thyroid. It just sticks out.
Palpate. I mean, typically it's some people it's a visual, some people it's a palpable situation.
What about nodules? What does that mean with nodules on the thyroid?
It can mean a lot of different things, and I mean, typically I'm typically having somebody get checked out by their physician if they've got nodules, just to make sure we've got worst case scenario ruled out, to make sure that there couldn't be a cancer or something like that going on, because we don't, we want to know what we're dealing with first before we start anything in that department.
And if we felt them when we were examining the thyroid, it would feel like there's some little pellets in that tissue, or like a pea size. They could be larger or smaller, but that it should feel really smooth and real symmetric. And if we feel something that's hard or rocky or funny shaped in there.
And if we found some, we would recommend getting an ultrasound to make sure.
In the medical community, they see them there, and they say there's nothing to worry about.
Okay.
And
We're
a lot of
concerned
times
about
they're
that.
on.
Yeah.
Yeah.
Can I say real quick, only because you guys both know me, but I've been on thyroid medicine for over 20 years. My thyroid got worse, I got higher dosage. I didn't know till I came here how sick I really was. And inflamed liver, I had autoimmune disorder, I had a something Hasi, I didn't even know that. I never had tests.
Hashimoto's.
Exactly. I never had tests like I had here to get my body well. Even though I felt good, there's a lot of things going on. So I'm glad I'm getting off with Lefroxin, and the only place I can get the Armour is here. But my body is, what you're telling me, and I believe it, is I can heal myself with the right care.
Mhm.
And so I'm so grateful. I'm so grateful.
Thank
We
you
didn't
for
even
sharing.
have to pay her to say this.
So I hope you learned something. We try to share what we know, and we've studied this for a long time and put it into practice. So we just wanted to share this with people because it's a big problem. There's a lot of people with thyroid problems that could get better care and have better health. So we wanted to offer this, and thanks for coming.
Thank you.
They were talking earlier today about having another class.
Yeah, well, we didn't know. I mean, we got a lot larger response than what we thought we would, so that's why the room is so full.
Thank you.
Yes, thank you for coming. We were considering possibly doing it again for people who had called, and we just couldn't accommodate the number of people who wanted to come and talk.
Another class, do you think?
Yes, we will do another thyroid class, yes.
This will also be available online, this talk. The gentleman back there is videotaping it, and it will be posted on our website. We'll be around, the three of us too, if there's other people who have a question that you might want to ask us, so that others who need to leave can go. Now, to reiterate, if you want to take advantage of the two-time special that we're going to be holding, the 2-appointment special, please step up front. What we will do with you tonight is take your payment of $89, which covers both appointments, and then I will personally call you at a time of your convenience tomorrow to set up your appointments with you. Okay? So if you'd like to take advantage of that, go ahead and come up front. Also, the book is available, Thyroid, Why Do I Still Have Problems?
How much is the book?
It's $18. It's not marked up. It's just the. Yes, I was just going to say it's not.